Okay. Ooh. Make sure my sound is on. Woo. Can we hear me? I hope so. Hello. Ooh. Ooh, there we go. Let's get some volume. Hi. Hi, everyone. How are you? Thank you guys so much for being here. You're watching online. Thanks for tuning in. And to those of you in person, thanks for not wimping out, you know? Yeah, it's been a cold week. It's warm now. We're Chicagoans, right? Winter doesn't scare us. Can't say the same for other people, but thank you guys so much for being here. We're really excited to have you here. For many of you returning. Is this anybody's first time at one of our lectures? Oh, we got a couple. We got a couple. All right. Well, thank you. Thanks for being here. I hope you have a good time. And if not, I'm sorry. No, I'm kidding. My name is Patty Swanson. I'm the founder and executive director of Chicago for Chicagoans. We have been around for almost 8 years now, which is pretty wild to watch your life flash before your eyes that quickly. But in all seriousness, it's been a really fun time for many years now. We do walking tours in the summer. We do this lecture series in the winter time. This is our 7th annual lecture series. The first year we tried to give tours in blizzards. You know, so we've grown, we've changed, we've moved indoors. But yeah, it's really nice to have you guys here. This year's lecture series, every lecture series has a theme. This year's is on the kind of incredible impact that Chicago has made all over the world. Things invented here, things that happened here that have just profoundly changed the world far beyond our borders. So we have a pretty exciting lecture series. We're going to be here every Thursday until April 11th. We have a lot of great ones coming up. The one I'm most excited about is happening tonight. So get excited, but we have a lot of really exciting topics, so you can always check that out on our website, chicagoforchicagoans.org. Conveniently, chicagoforchicagoans.org is also where you can find our donate page. We are a 501c3 nonprofit. We are 100% supported by individual donations, and our staff are all volunteers, including myself. So all of your money pretty much goes right back out to paying our talented speakers and lecturers for their time, and to paying for insurance and stuff. So we really appreciate your generous donations. Again, you can make those donations online on the donate page on our website. We also have lots of QR codes scattered around the room. We accept cash, check, credit card, kidneys that we can sell in the black market. Just kidding. Really, any kind of payment you want to give us, we can probably take. Zelle, PayPal. What other words can I say that mean money? Venmo, all of them. We take all of them. But the question I often get is which one takes the least amount of fees? And the answer to that is cash. Anyway, so yeah, if you have a great time tonight, if you want to support our programming, our mission is to create history events that are pay what you can, so anyone, regardless of their income, can come to one of these and learn more about the history of their own city. So that's what your money goes to support, and we're really excited to have your support. Without further ado, I feel like I've stalled for enough time. I'm really, really excited to present tonight's speaker. She is our Hegwish tour guide. If you don't know where Hegwish is, I have a really fun activity for you to do this summer. It is, I'm pretty sure, the only walking tour of Hegwish. You can see Chicago's only sawmill. There's a lot of cool things down in Hegwish. Not only is she our Hegwish tour guide, she's also one of our favorite lecturers, talking on all kinds of wide-ranging topics. We asked our speakers, we give them the theme, and then they tell us what they want to talk about. I didn't expect to get a proposal for poison control. So I'm really excited about this one. That's why I'm most excited. We always get really interesting proposals, but I usually see them coming. Not this one. Nope. So without further ado, give it up for Emily. She's going to talk to you guys about poison today. Yay. Stay safe.
Okay. Hello. Welcome. Is this good?
You're good.
Okay.
You're good.
Great. So today I'll be talking about poison control centers, and just kind of wanted to start off by pointing out these comics that are on the handout, which you can also look up online. And this comic tells about a common situation that happens in the U.S. every day, multiple times a day. that a teacher or a parent, a guardian, calls a poison control center in a state of panic, oftentimes, because a child in their care has somehow gotten into some kind of household product, like a gel pen in this comic, something like a packet of silica gel, a household cleaner, and the person on the other end of the line listens sympathetically and carefully gathers information and lets them know what to do. And this might be, in a serious case, going to the emergency room or following up with a primary care doctor, maybe monitoring them at home. But also in a lot of cases, it means assuring them that ultimately there's not likely to be a problem and the kid will be okay and the caller can breathe a sigh of relief. And so every day people call poison control centers in cases like these to cope with these scary situations and determine if they need to act, and if so, how. The people who work at the centers are often pharmacists or nurses or physicians, and they train hard to learn a lot of information as well as to be able to reassure and comfort people who call, many of whom are, very worried or agitated. So these centers, in addition to keeping people safe, they also have a lot of other benefits as well. They save money because they help prevent people from having to use something like an emergency room if it's not necessary. They also have, over the years, had a lot of effects on regulation of dangerous products and public information about potential threats in their own home. But for years, this service didn't really exist. The first poison control center opened in Chicago in 1953, and these centers pretty quickly spread through the nation. So to understand why, it helps to kind of take a look back at the proliferation of new household products and medicines in the late 19th and early 20th century, and just to figure out what had changed and why this had become such a necessary and important service. So if you go back to late 19th century, early 20th century, there was little regulation about what could be included in things like food and medicine and household products. Labeling of the components of a lot of items wasn't really required or regulated at a federal level. There were some laws, like patchwork of state laws, but these weren't always consistent or enforced. So, there were some common ways of labeling dangerous products, such as the, good old skull and crossbones symbol, or just putting the word poison in big letters, maybe using a different shape of bottle, but a lot of these were voluntary. So as a result, just to name a few examples, there were examples of things happening like ingredients like formaldehyde and chalk being included in milk as a way of, producing it more cheaply and making it last longer. Yeah. There were patent medicines, the sort of quack remedies, as they're often known, that included potentially dangerous substances, things like alcohol or morphine or opium. And this could be even for products that were used for children, like teething syrup could contain some dangerous products in it. And people didn't really know. People didn't know what they were buying. So some associations, like the American Medical Association, had called for more regulation and called for ways of labeling products better to distinguish the dangerous products from the safe ones, but the legislation for this lagged pretty far behind. So over time, journalists and reformers, along with scientists, doctors, called for more regulations of what medicines and household products could include. And you can see some examples of this. There is one very inventive invention, a proposed way of making sure people stayed away from bottles with poisonous ingredients by use of a spike around the bottle, so you would really know not to use that. And that was, I mean, that was a patent application. There's also a cover from Collier's magazine in 1905 about patent medicines. And if you look at it, it's got a skull there, but if you look closely, there's bottles at the bottom where the teeth would be. So just really driving that point home that people needed more regulation. But again, there wasn't a lot that was required at the federal level. So slowly, reformers did make some progress in calls for labeling and testing things like food and medicine. And indeed, some of this did come from muckraking journalists and writers from Chicago. One famous example is Upton Sinclair's The Jungle, which shined a light on unsanitary practices in food production, and that helped inspire the passage of the Pure Food and Drug Act in 1906. There were also other people who were doing some very interesting things. The Pure Food and Drug Act was also known as the Wiley Act, and Wiley was a doctor. I believe he was from New York, so not a Chicago guy, but he actually did some really interesting things where he would recruit young men to eat adulterated food, to do studies to show how dangerous this was. Well, I mean, a lot of them did have ill effects from it. Yeah. So the Pure Food and Drug Act did have some effects on how foods could be labeled, how medicines could be labeled, and that sort of thing. It also created a precursor to the Food and Drug Administration. So this was kind of moving in a direction of more safety in terms of consumer products and food and medicine, but there were also limits to it. For example, in the 1920s, there was a really tragic example of an antibiotic that had been sweetened with antifreeze. And this was on the market, and there were some fatalities from this. And ultimately, the FDA was able to, act to take this product off the market, but there wasn't really much they could do beforehand to make sure a product like this didn't get out there in the first place. And there's some examples of, here's the cover of Puck magazine. This was a comment about the Pure Food and Drug Act. You can see like a scientist examining food. So that was part of what was happening. And then there's another couple of images here. This is a man named Chevalier Jackson, who had also pushed for accurate labeling and safety of products. And he did some things like talking to Congress And he pointed out, and this was in the 20s, so even after the Pure Food and Drug Act, that a box of baking soda and a box of rat poison looked really, really similar. The rat poison did say poison on it, but similar enough that it could put people in danger. Just an interesting aside about Chevalier Jackson was he also, as a doctor, removed items that people swallowed. He was a surgeon, and he kept a collection of these, which you can visit.
Where?
Philadelphia.
Oh my God. Creepy museums one must visit.
Yeah. So after this Pure Food and Drug Act, there were some other laws that kind of improved on it. For example, in 1927, there was the Caustic Poisons Act, and that helped regulate some of the packaging and sale of things like lye, things that were caustic and could harm people. There was also a 1938 law called the Federal Food, Drug, and Cosmetic Act, and this required pharmaceutical companies to submit an application for drugs to be approved, so they could be denied. But there were loopholes in this legislation, and one of them was that a lot of these regulations didn't apply to many household products that weren't meant for people to ingest them. There were also things like medicines that were just easy for kids to get into. And this was also a time when home economics was becoming a real science, I guess. There were a variety of new products that were meant to help people clean and try to get rid of as many germs as possible. There's, for example, Good Housekeeping magazine had started something called the Good Housekeeping Institute. And this was a model home that included a bathroom and a kitchen, and they tested products there, just really getting into this range of new products that were meant to keep your home clean and like look at all these different new chemicals and how effective they were. This was also a time of a growth of a lot of hygiene products. Things like Listerine, which was invented late 19th century as a surgical antiseptic, but later was marketed as a mouthwash. Again, like making sure people were as clean as possible using these products. Lysol, which was also invented around the same time, was marketed as a cleaner as well as a feminine hygiene product for a while. So everywhere people were seeing products and advertisements that professed they could get rid of the germs and be clean, keep their homes clean. And, you know, they didn't necessarily know what were in these products.
It's like men when you say vasectomy.
Wait, that's not get curious.
Just to kind of underline the rise of all these products, the sales of this kind of category of products that included cleaners, medicines, and hygiene products went from about $40 million in 1879 to $765 million in the US in 1920. So people were buying these new things.
In the dollars of that time, or adjusted for today's
You know, I'm not sure. I think it may be the dollars of that time, but
Wow.
I'm not 100% on that.
Wow. Okay.
There were also things that were added to cleaners and other household products during Prohibition, for example, that made them more dangerous than they originally had been, because some people wanted to prevent people using products with alcohol to drink them. So they would add more dangerous elements to try to prevent that, and you know, it didn't always work. Some people would take them anyway. There was one judge who said in 1920, "Prohibition is a joke. It has deprived the poor working man of his beer, and it has flooded the country with rat poison." One popular book from the 30s was called 100 Million Guinea Pigs, referring to the population of the US at that time, and basically detailing this growing list of products that were marketed to Americans and their dangers. So I'll read you an excerpt from that. It says, in the magazines, in the newspapers, over the radio, a terrific verbal barrage has been laid down on 100 million Americans. First, to set in motion a host of fears about their health, their stomachs, their bowels, their teeth, their throats, their looks. Second, to persuade them that only by eating, drinking, gargling, brushing, or smearing with Smith's whole vitamin breakfast food, Jones's yeast cubes, blue giant apples, Prussian salts, Listroboris mouthwash, Grandpa's Wonder toothpaste, and 1,001 other foods, drinks, gargles, and pastes, can they either postpone the onset of disease, of social ostracism, of business failure, or recover from ailments, physical or social, already contracted. So just really summing up this idea that these products had effects that were unknown and potentially dangerous. The book wasn't necessarily completely factual in the details, but the overall idea about all of these products and their unknown effects was basically accurate. And by the time of 1950, there were about 250,000 brand name products on the market, so much more than before. And there were, as I mentioned, in a lot of cases, products that people didn't really know what was inside them or what danger they might hold. So it was in this context that doctors and pharmacists started working toward the first poison control center. Doctors and pharmacists had become increasingly alarmed at accidental poisoning among children, and it's estimated that from 1949 to 1950, there were at least 800 children in the United States who had died from accidental poisoning, which is a much higher number than today. So there were a lot of these dangerous products and not enough safeguards to keep kids safe. And often doctors didn't really know what to do about these cases. They didn't know how to determine what a kid had ingested or what to do about it. Even medical manuals of the time didn't really have the information they needed. So one key figure in the development of this poison control center was a man named Louis Gdahlman. Yeah. He was a pharmacist who was working at what was then called St. Luke's Hospital, which is now the Rush University Medical Center. And you can see a picture of him here. He had graduated from the University of Illinois in 1930 from its College of Pharmacy, part of what he called the Depression class of 1930. And he'd worked as an apprentice to a pharmacist named Andrew Shearer, who had run a pharmacy at the corner of State and Division at that time. It's actually, obviously no longer exists there, but it's not far from a current pharmacy in a similar location. There is a CVS right nearby. So Gdahlman was very bright. He graduated as the co-valedictorian of his class. And even after he graduated with his pharmacy degree and started at St. Luke's, he took night classes in chemistry at University of Chicago. And at the time, that pharmacy department at St. Luke's just had 3 people in it. So there was a pharmacy director, Gdahlman, and a delivery boy. But the hospital was pretty large, and every day the pharmacy filled about 1,000 orders. Yeah. And also the work of a pharmacist in those days was a little bit different, since pills weren't really in ready-to-dispense format. They needed to be prepared. So I think they were kind of, yeah, they were compounded. Mm-hmm.
I worked in a pharmacy in the 1960s, and one of Emily's uncles was the pharmacist. My job was to go to all the pill bottles, which were these tall, dark brown glass bottles, and dust them, because what the pharmacist would do upon receiving a prescription is find the bottle, count out the number of pills or whatever the thing is. You might remember, if you've seen It's a Wonderful Life, the pharmacy scene early, they had to take powder and put it into capsules, and like it was a lot more hands-on and subject to whether they were doing it correctly.
Yeah, and that was not even all that a pharmacist would do, since a lot of times doctors and nurses would ask them for advice if someone had potentially been exposed to some sort of poison, or if there was something they didn't know about medications that might interact with each other. So since Gdahlman had his experience not only in pharmacy, but also in chemistry, and he also just had a lot of curiosity and a desire to help, he became known as a great person to talk to in these hard cases sometimes. And so he started making these index cards as he would research different products, different substances that people had. And he gathered a library of books. There's even a story I read that at one point he had retained this is a little gross, but he had retained the contents of some patients' stomachs to study them and find out more about, things like different products, different chemicals. Yes.
Digested?
Yeah, and what you could learn from them, the effects. So over time, he had quite a collection of these index cards, thousands of index cards with information about different substances and products and the effects that they had. He also developed a standard form to use to capture information about people who had been exposed to some sort of poison, some sort of dangerous product. And over time, people were calling him, both doctors from St. Luke's and also doctors at other hospitals in the area who heard about him and all this knowledge he had. And eventually he started just telling the switchboard operators at the hospital telephones to patch the calls through to him at home when he was home. So he would be willing to take calls day and night. His wife said, quote, Lewis was called day and night from all over the country and was on duty 24 hours a day. He never refused a call. There was no other service like this anywhere.
God bless her.
Mm-hmm. So meanwhile, other pharmacists and doctors were also concerned about this issue of childhood poisoning. One was Dr. George Wheatley, who was vice president for health at an insurance company, Metropolitan Life. Another was Edward Press, who worked with children with disabilities at U of I. Press would write about the dangers of what he called test tube toxins. He said, quote, "It is no longer necessary to go surreptitiously to the apothecary to buy some arsenic in order to have poison available. Lethal amounts of carbon tetrachloride, kerosene, rat poison, potassium permanganate, parathion, hair curling solutions, or bleaches can be and are bought at the corner drugstore, the neighborhood service station, or the supermarket every day." So at this point, the Illinois division of the American Association of Pediatrics, which was a pretty new organization, just founded in 1930, but they formed a group called the Accident Prevention Advisory Committee to find out more about accidents that affected people, particularly kids. And they found out that at the time, poisoning was the most common cause of childhood accidents. Was in about half of cases of childhood accidents, more than, injuries from falls and that sort of thing. So this was a really big issue at the time. And so based on this information, they formed a subcommittee to figure out what to do about this poison problem. And they developed an 85-page manual just with information about all of these different products and the contents they had, the dangers. And in November of 1953, they opened that first ever poison control center at St. Luke's Hospital.
And how many employees did they have?
Not many at first. They basically had just one desk and a phone at first. So there were a few people involved, but it was a pretty small operation to start with. And at first, they just took calls from doctors and hospitals. It wasn't yet open to the public. That would happen a bit later in 1961. And actually, just as an aside, if you look at places like a lot of countries in Europe, they have poison control hotlines, but they're only for doctors and hospitals in a number of countries. So the U.S. is, one of, I think, a few countries where you can call just as an everyday person, and you don't have to have a hospital call. Also, at first, since it was coming from the American Association of Pediatrics, the focus was mostly on kids. That would change a bit later on. But it did have a big impact. They responded to calls. Newspapers reported on this new center. And they not only were responding to these calls, but because they had, forms and the index cards, and you can see some examples of this. These are from a little bit later, but there's some file systems. I believe these are from the 1950s, a little bit later in the decade. And then also, you can see this form from the Chicago Poisoning Control Program. This was in an article by Edward Press, one of the people who started the Poison Control Center. And this was a standard form to collect information. So not only were they able to help people that they were called about, but this was a lot of really valuable information, and they reported it all to the Chicago Board of Health. So they were able to find a lot of important information about things like common products that led to problems. One, for example, was baby aspirin. Yeah. At the time, it was flavored like candy to try to make it more palatable to little kids. And also, it was available in big bottles. So, yeah, this was pretty dangerous. Kids would want to get into it because it tasted good. Mm. 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 I mean, eventually this information that they gathered did lead to changes. For example, with baby aspirin, it was put in smaller bottles so kids couldn't get as much at one time. And a bit later on, also, there were things like child-proof lids. Another key example of research that people involved with the Poison Control Center did had to do with lead poisoning, which was also a big problem at that time, and really for a number of years leading up to the 50s and 60s. If you kind of look back a little bit, you can see this is an advertisement. Well, it's a paint book for girls and boys. the Dutch boy's hobby, and this boy is riding on a horse that says lead. So, yeah. There's also an advertisement, and this was from National Geographic in the 20s, about how lead helps to guard your health. Just talking about how, modern pipes have lead, and, you want to have modern plumbing to avoid sickness. And this was despite the fact that some physicians, as early as the 1890s, were sounding the alarm that lead paint was very dangerous. At that time, they mostly talked about the most serious cases, like things that could involve comas or even fatalities. But over time, people learned more about how even in less severe cases, lead or exposure to lead paint or gasoline can lead to things like learning disabilities or mood disorders, in addition to physical symptoms. By the 1920s, some countries, including Britain, had already banned lead paint, but it was still fairly common in the United States. And, as you can see from those advertisements, paint companies were eager to suggest that it was no real problem. Some activists in Chicago had been at the forefront of efforts to raise awareness of the dangers of lead poisoning and call for more regulation. Before the 1950s group that set up the Poison Control Center, there were people like Alice Hamilton, who was a doctor who worked with Hull House, and she studied occupational injuries and diseases, and she actually wrote a book called Industrial Poisons in the United States in 1925, and focused particularly on things like lead poisoning that affected workers in industries like oil refineries and printing, since in the 1910s, 1920s, printers used lead-based metal type.
Still do.
Oh, really? Wow.
If you're printing letterpress, you're supposed to wash your hands before you snack.
So despite the growing concern that some physicians, some scientists had about lead paint, it did continue to be used, and not just in house paint, but in things like babies' cribs and toys, a number of other household products. And as you may be aware, lead paint is dangerous to everybody, but particularly for kids, both because of their developing nervous system, but also because, they're more likely to put things in their mouths, And, yeah. So some of the people involved in the first Poison Control Center really did a lot to raise awareness of the dangers of lead paint. There is a map here, and this was part of a study put together by Joseph Christian, who was one of the people involved in the Poison Control Center, and a few colleagues, just looking at lead poisoning in the different community areas of Chicago. And, you can see that by the time, you got to the 1950s or so, 1950s, 1960s, the use of lead paint had gone down in a lot of areas as people became more aware of the dangers, but there were particular places where it was still a big problem. And often these were lower income areas, places with public housing and that sort of thing. And because of this, some people were less inclined to take the problem seriously since it didn't really affect them, and sometimes, would even place the blame on families who lived in places where there was a lot of exposure to lead paint. So these types of studies and this kind of awareness did help to bring this problem out into the public more. And you can also see there's a photo of a group called the Student Organization for Urban Leadership. This is from 1964, or actually I think the photo's from 66, but it was a group formed in 1964. There were also a number of other groups that were these community groups who, just as the researchers were finding out more about people's exposure to lead paint and the problems that it involved, were also getting involved and doing things like carrying out testing on kids and giving out pamphlets and that sort of thing. And eventually their efforts did begin to pay off. In 1970, there were amendments to the Clean Air Act that led to the elimination of leaded gasoline by the 1980s. And by 1972, there was legislation to ban the use of lead in paint. So by this time, lead had done a lot of damage, but at least this legislation was helping to combat some of the harm for the future. Today, there's still danger that kids face from things like lead, but it's less likely to come from things like paint and more likely to come from things like jewelry or certain types of cosmetics, certain types of like unregulated medicines that you might get from, like traditional medicine sources. So you can see that this first Poison Control Center and a lot of the work they did, the awareness they raised, did lead to a lot of increased public visibility for making products safer, and increased legislation to regulate some of these products. So one example was in 1961, John F. Kennedy declared the first Poison Prevention Week, which is a national declared week with various events to raise the issue of poisons in products around the house. There was also in 1970 the Poison Prevention Packaging Act, which required child-resistant packaging for things like prescription medication and various types of over-the-counter pills. You could also see that the center was successful in that many, many others opened after that. One person named Jay Arena, who had worked with the Chicago Center and was from Duke University, opened the second one at Duke shortly after. By 1958, so just 5 years later, there were 265 poison control centers. And by 1970, there was a high number of 661. So this was very, very effective at spreading just across the nation. And even just looking at the Chicago area, there were 11 centers at the highest point. These hundreds of poison control centers weren't all equally effective. Some were these big, well-staffed centers that were associated with hospitals where, they might have been associated with research institutions and that sort of thing. Others were pretty small, often poorly staffed, and closed a lot of the time. So over time, people did become aware of the need to standardize these centers and certify them to make sure that the advice they were giving out was good quality and the people were trained well, and also that they would be open when people needed them. So eventually, in 1957, the Surgeon General created the National Clearinghouse for Poison Control Centers to help these different centers share information, begin to use a standardized way of collecting information. And the Chicago Center continued to be, an example for a lot of other centers in the nation. As time passed, the poison control centers did face new obstacles, but they also expanded their services as was needed. So, as I mentioned, soon they weren't just open for hospital calls, but starting in 1961, the general public could call. And by 1970, 80 to 90% of calls were from people from the general public and not from doctors or hospitals. So there were advertisements to help spread awareness of the centers, and often dangerous products, potentially dangerous products might list a number for them. They did also continue to consult on cases for doctors and hospitals, which they do today, especially if the cases are particularly severe, that might come up. And over time, thanks in part to these centers, as well as to this increased legislation, increased awareness of the dangers of certain household chemicals, there began to be an effect. So accidental poisonings, which had caused the death of around 400 children per year in the 1950s, now causes fewer than 50. Wow. So, I mean, it's like, obviously, it's important to get that number even lower, but, it's yeah.
And the population's greater, too.
Yes, it is, yeah. Yeah, from the 1950s to the 1980s, childhood poisoning incidents declined by about 88%. So there was a big effect there. And over time, they weren't just known for specializing in childhood cases, and more people of all ages started to call. Today, still about half of the calls that poison control centers get are for kids who are pretty young, like under, I believe it's under 6. But the others are for people like teens and adults. And in some cases, teens and adults do have more severe cases. So it is really important that this service is there for them as well. might be cases involving things like accidental drug overdoses or things like people mixing up medication, that sort of thing. So it's a very important service. There even are some calls about pets as well. I mean, in a lot of cases, people might want to call their vet instead, but it is a service that that will take calls about people's pets. Another important function of the Poison Control Center, especially in Chicago, is being able to respond to things like panics about health crises. And you can see here, this is from the days of the Tylenol murders in 1982, where 7 people were killed by cyanide that was placed in Tylenol capsules. And that was, at least at that time, the busiest day for the Chicago Poison Control Center in its history. I mean, they weren't getting calls from the victims, but from people who were really concerned, and so they helped with that, helped comfort the public and give them information. And also a lot of people who worked at the center at that time, they helped with efforts to figure out which examples of the Tylenol products might be dangerous as those were taken off shelves. So just to give you a statistic about that, at the time, the Illinois Poison Center, which was its name, it is its name now, usually received about 40 to 60 calls per day, but in the day of the Tylenol murders becoming public, they received 800 calls in just one day. And after that incident, a whole new raft of different changes to drug packaging and safety went into effect. We had already had the Poison Prevention Packaging Act in the 70s, but pharmaceutical companies started adding new things like safety seals, cotton balls, blister packs, and other things to make it really clear if the product had been tampered with. And there's other crises that these centers have responded to over time. Things like the anthrax attacks in the early 2000s and people's concern about that. Also, the opioid epidemic and various problems that have arisen with things like particularly dangerous substances being added to drugs. And so these centers have been able to gather that information and alert people about that.
Are there any statistics on Tide Pods?
You know what? I'm not sure. I know that I don't know any statistics on that. I do know that people who work for poison control centers have commented on that and have commented on seeing a rise in those types of calls. But yeah, I'm not sure on statistics. So over the years, it's become really clear how much these centers benefit people, since they do respond to problems with people's health. They save money and time. And the current estimate is that about 80% of people who call poison control can be treated at home. So this does save them from having to go into an emergency room to figure out what's wrong. They save a lot of money, since every dollar that is spent on a poison control center it's something like $13, I think, that gets saved in healthcare costs. Today, there are 55 poison control centers nationwide, and there is just one in the state of Illinois. That was true by 1997. But in the early 2000s, for the first time, all of the centers shared the same phone number. So you could call the number and you would get your local center or the one covering your area. There are some different updates that have occurred over time, and you can see some examples, such as going from index cards to microfiche. Yeah.
There you go.
Big time.
I'll be back to you in like 20 minutes.
Different forms from the 80s and 90s. Of course, today you can use their website. There's also this Mr. Yuck symbol that's been used to replace the skull and crossbones symbol, which people considered ineffective at warning kids away from dangerous products. Either because it just didn't do anything for them. Yeah, I mean, they think it's cool. So one thing that has been true over time is that a lot of these centers do face difficulties in things like funding, since it's not only from one place, but typically cobbled together from different sources, including federal funding, local or state funding, and funding from private companies like hospitals, other health organizations. But the Illinois Poison Center, which has faced a couple of threats to its existence, is still around and has been around for 70 years now. So it's been lasting for a long time and continuing to help people in Chicago and in this area, as well as around the country. All right, so if anyone has questions, yeah.
What was the drug Trump said would cure COVID, and did poison control get calls about it?
Oh, you know, that...
It was like a pool thing, like a pool horse thing?
It was bleach.
Well, yeah, I mean, I do know they definitely get calls about bleach. Are you talking about ivermectin?
Yes. Yes.
I'm not sure of any data about that, but I wouldn't be surprised.
Thank you. Sorry for getting polluted, but also not sorry.
Was that your horse feed store?
So not so much as a question of the comment, and as a teacher I hate that because my kids do that all the time, but I find it fascinating that the Chicago, the Student Organization for Urban Leadership,
Mm-hmm.
And I'm looking at this like, I would love to read more about the correlation between the rise of civil rights movement here, especially here in Chicago, because what I'm seeing is these are the people who are most, squashed and the government is let down, and that they had to stand up to fight against lead poisoning.
Yeah.
When, if you, because I did a little search, like they knew in 1914 it was dangerous.
Mm-hmm.
And in 1964, it took a bunch of students of color to say, hey, stop poisoning us. So
Yeah.
I think that that's a really cool, like, Chicago,
Yeah.
the unique history of Chicago and us being justice seekers, you know, and a hotbed for civil rights, that it took, Chicagoans to do that.
Yeah, and I think Chicago played an especially big role in these organizations fighting against lead poisoning and the use of lead in paint, possibly because Chicago has always been, or for a very long time has been, like a pretty segregated city, so certain areas were more affected and brought people together to fight that.
Lead lobbyists also had a big hand
In squashing that.
John Oliver has a great segment about lead. Yeah,
Someone online wants to know why Malort isn't marked with Mr. Yuck.
Because it's delicious.
Is that person my husband by any chance? He is watching online.
Malort, I learned, is no longer made with wormwood,
I know, it doesn't
which
taste
is
the same
which
anymore.
is a poisonous.
Yeah.
You've probably heard of.
Malort is
Pernod and
definitely poisonous. Yes.
Sufficient.
Poisoned me before.
Yeah.
Did poison control have any comments or thoughts about the lead water service lines? Because they're talking about all these other we're trying to get lead out of places. But Chicago has a huge lead service line problem, which has been directly poisoning people.
You know, I'm not sure on that, but I mean, that is a really interesting question.
I might have an answer for you.
Yes, it was your husband.
So, I have a friend who's in the medical field in epidemiology, and so as a parent, a couple of years ago, the park district was like, don't drink from the water fountains, there's a lead issue.
Mm-hmm.
And then if you notice, they started running the water fountains constantly. So, according, because I was like, I'm not drinking that, and then I have students, I'm a teacher, send them out, oh yeah, drink from that. Oh wait, no, don't drink from that. According to my friend, who's a scientist, the constant running keeps it to an acceptable level.
Yeah.
But what about at home? That's what I mean.
Once they get into your home, they're no longer, it's not the same pipes, I guess. I don't know.
Sure, yeah.
But
Okay.
it was definitely the park district water fountains that were the concern.
Yeah.
I don't know, let's just all go buy a case of Evian. Or champagne.
So for people's homes, I've read that essentially what happens is lead is very soluble. So if the water is sitting in the pipe at pressure, it's essentially going to absorb the lead molecules. So if you have lead pipes in your home, basically what they recommend is that in the morning, you let the water run on all the taps for a while to basically, quote, flush the system in your house, then go ahead and use it, because overnight while you're sleeping, it's essentially seeping into the water held in the pipes. That way when you go to use it in the morning, you're basically getting a heavy load of lead that's been soaking in the water. Think almost like tea or coffee, it's just seeping.
But if I don't have lead pipes in my home, but
You're okay.
but they're coming through lead pipes to get to mine.
So generally it's the service line, which is what they call between the line under the street or under the sidewalk to your house. So in most cases, the main lines have been replaced, but the problem is that up until I think the late 80s in Chicago, they required service lines to be lead. So yes, that is lead going into the system, but the ability for it to be catastrophically bad, it's bad no matter what, but it's limited of what it would otherwise be if the main lines, the service lines in your house were all lead, which it is in some cities.
Yeesh. Get a Brita.
Brita doesn't filter lead.
Lead particles are too small.
So it's not really a question. Everything you said is amazing. It's more, if people are curious, as you were talking, I thought of two really, really good books that help explain, poison in the U.S. So there's this amazing book called The Poisoner's Handbook by, I think her name is it's either Elizabeth or Emily Bloom.
Deborah Bloom.
Deborah Bloom. Oh my God.
Yeah, I love that book. It's great.
Yes, it's amazing. So it's about the rise of toxicology and forensic science in the U.S. during the Jazz Age. It's amazing. People read it. It's super, super cool. And it talks a lot about like the Great Depression and how the federal government adulterated alcohol, killed hundreds of thousands of people. Really bad. And then there's another book that talks about leaded gasoline, and it's called The Big Roads. It's actually about the development of the U.S. highway system and then the interstates. But the writer Earl Swift also talks about the rise of leaded gasoline at the same time, and how even when it was first created, they knew it was poisonous, but the auto industry basically punched back and it was allowed to exist.
Yeah.
So, fun fact, the guy that was the lead in developing leaded gasoline, Thomas, oh my god, what is his name? Basically, he also developed chlorofluorocarbons. So basically, Thomas Midgley Jr., he essentially was the lead in developing leaded gasoline, knew it was poisonous from day one, still promoted it, got it widely adopted worldwide, also developed CFCs, so essentially he is considered one of the largest mass-scale poisoners in human history.
Patty, I think we have someone who needs to sign up for your tour guide class.
Any other questions?